Hi, welcome to PCOS 1 in 10. My name is Naomi Cowan. I'm a singer, songwriter, artist, and community builder. Now, today I have a very special guest with me. Her name is Shelly-Ann Weeks, aka Dr. Sexy-Ann, who has dedicated her life's work. So much you have poured into educating young women, women, girls all around the world about the female reproductive system and why it's important for us to understand our bodies and own our health in a positive way.
Facts.
Yeah, man. And so today we're talking about PCOS, which is
Polycystic Ovarian Syndrome.
Polycystic Ovarian Syndrome, a condition that women around the world experience and we're still learning about.
Quite so. And you know what? It is so interesting because whenever we talk about PCOS, it really is a puzzle because there are so many weird symptoms that people don't really put together. And that is why it is so important for advocacy and awareness building, because it really helps us to be our own health advocates. So when we're talking to our doctors, we'll know how to guide them. And just simply put, PCOS is a condition that is caused by hormone imbalancing. And what happens is the ovaries will grow cysts on them. And sometimes it can cause the ovaries not to be able to produce actual viable eggs, and it affects your fertility. As a matter of fact, for a lot of women, that is the first sign that they use to discover that they have PCOS. They're trying to get pregnant and they're unsuccessful.
But let me ask you, so usually women, when they're about to actively, intentionally try to conceive, they discover this condition. However, how early can someone be diagnosed with PCOS?
Okay. Well, PCOS affects women from in childbearing age, so from puberty right to menopause.
Meaning from when you start
from when your period just starts right up to menopause. Women as girls, I should say, girls as young as teenage years have developed cysts on their ovaries. But like I said, it is a mix of very, very strange symptoms. So a lot of the times it's not very quickly picked up, and it's not the first thing that is diagnosed, which is why it's so important to understand and know your body so that you can recognize when your body is functioning healthily and when there is a problem, which is why I make sure to let girls understand that having a monthly cycle is a healthy thing, it's a good thing. And missing your period is actually the opposite. So, you know, a lot of people say, oh, I don't have the period this month. Yay! Not really. Because if you're not pregnant or on a birth control or doing some sort of hormone treatment that's causing your period to be irregular, you should be having a monthly function every month. And if you're not, you should be concerned.
Well, that's why it's called a cycle.
Yes.
You know, the sun rises every morning and so does the moon. And so those are the things that life has put in place for us to see and know what to look out for. So what are some of the common symptoms and also the symptoms that we don't really pick up on?
All right, well, common symptoms, as I was alluding to earlier, is a missed period. So if you have a situation where you do not have 12 monthly cycles, sometimes you'll have young ladies having as little as 3 or 4 cycles for the year. That is something to be concerned about because you should be getting a cycle every single month. Another thing that you realize is that you might get unexplained weight gain. And I say unexplained because, you know, sometimes we know when we eat too much and we put on the pounds. But in this case, because of the hormone imbalance, you will gain some weight because whenever your body has excess estrogen in it, it develops a lot more fat. And then you have this extra weight and you're saying, but I'm not eating anymore. I don't understand why.
Right.
So that's another one. That's probably the one that's a little bit more iffy because you're not going to make the link immediately. Another thing that people need to look at is the weird hair growth. I've seen women with PCOS with full-on beards. Sometimes it's just like a few wispy strands. Sometimes you get full-on chest hair. And these are just things to pay attention to and make sure that you make a note of them so that when you're having that conversation with your doctor, they can help to guide you and actually look for PCOS because it can go misdiagnosed.
Wow. And then is there anything else that sometimes women may experience that they don't see that it's PCOS? So for example, for me, it was acne.
Acne, definitely, because remember that your hormones affect all of your body functions, you know, and acne is one of those things. But the reason why acne is kind of one that is missed as well and the connection is not made right away is because acne is so common. So, I mean, how many people have acne and immediately go to PCOS because of their acne? So that is why it's so important to pay attention to all of what is going on with your body, so you know the difference between when you're healthy and when something is up, so that you can make that connection. Because that is the reason why it takes so long for a lot of women to be diagnosed with PCOS, is because they are not making the connection between these specific symptoms and the fact that you do in fact have a hormone imbalance. Because our hormones affect everything from our sleep to our appetite to our emotions to our sexual feelings. So all of those things come together to really tell you how your body is functioning. And that is why it's so important that we know what it feels like to be healthy.
And speaking of hormones, I would think that it also affects your mental health.
Oh, without a doubt. Without a doubt. And, you know, just female reproductive health overall is something that really weighs a lot on our minds. And that is a very, very big part of the whole conversation too, because stress, don't underestimate the power of stress, you know. Whatever you have, stress make it worse, you know, man. So even if you're having this chronic acne and you're under stress, you're sleep deprived, your sleep is something as well. So there's a whole heap of things from a lifestyle standpoint that really does make our health a lot worse, and it does affect PCOS as well, and it can even affect our overall quality of life, especially when you have such a debilitating symptom.
So let me ask you, when, let's say I may have one or two of the symptoms you've shared, how is it diagnosed? What's my next step?
Well, first of all, this is a continuous conversation with your doctor, right? Because they're not going to jump straight to PCOS if you show up with acne symptoms or if you gain a few pounds or something like that. So it's a continuous conversation. Like I said, you're making notes of your different symptoms. But what they will do as well is they'll do ultrasound to look at your ovaries to see what's going on with them in terms of their overall health. Are there any cysts growing on your ovaries? And they will look at your hormone levels as well, because that will help them tell you whether or not you have an imbalance. Is there something out of place? And they're going to be asking you as well about your periods, how your flows are, because some people will get a cycle, but they have a few days of spotting. They don't get a full-on flow, and that is something that they look at as well. But it is a function of a relationship that you must have with your doctor, so that they can definitely help you to see exactly what is going on with your body.
Right. And then so after you're diagnosed now, you do an ultrasound or you do what they call a probe, which is they get right up in there.
Same ultrasound, they just take it from a different angle.
Right. And they may have identified and said, hey Naomi, we've discovered that you have PCOS, or there's PCOD, which is the disease. I know that there's sometimes a difference between the two, or how does that work?
Well, I've not heard it being referred to as PCOD, but what I do know is that there are different levels, because the women suffer on a spectrum. So your experience with PCOS may not be the same as my experience with PCOS, because you have women who have had PCOS and it completely derails their fertility. You have women who have been diagnosed and they are able to be treated and be able to have children afterwards. So it depends on where you are on the spectrum, how severe your symptoms are. But there are a lot of things that you can do from a lifestyle standpoint to help you have a better quality of life, even with PCOS.
Right, so the next steps, right? So from my personal experience, OBGYN, when she diagnosed me, and I said, well, what is this? I don't know much about it. And she said, well, only until you're ready to try to have a baby should you worry about this. And I walked away from that feeling a little bit, I guess out in the dark, because
you wanted more.
She gave me a diagnosis for something that is not right. And she told me I wouldn't need to worry about it until a later time. It was only through self-education and speaking with more doctors I was able to look at how to live with it. So what would be the ideal next steps after being diagnosed with PCOS?
Well, the next step is educate yourself. You did the right thing. Educate yourself more about PCOS, because like I said, not everybody's PCOS journey is the same. Another thing that you have to do is to recognize the different lifestyle choices that you can make to have a better experience overall. So one of the things right away that you have to do is to figure out, how can I get this imbalance more balanced in terms of your hormones? One of the things you can jump to right away is what you're putting on your plate, your exercise, your stress management, how much sleep are you getting. Immediately, just by improving those things, you will find that your symptoms will be much, much better and easier to handle. Another thing that you have to understand and recognize is that even though your doctor will say to you, oh, well, you don't have to worry about it now until you're ready to have children, a lot of times that's not a very long window. So if you intend to have children, I would get more information along those lines to find out, okay, so I might not want to have children right now, but how much time do I have between now and when I'm ready to have children? Or do I need to maybe change my plans and have a child right now based on where my ovaries are, what's going on with the PCOS? But it is a continuous conversation. It's a relationship, and you have to have a doctor that's willing to go the extra mile with you, because that is what it's going to require. They're going to need to spend some time and help you and guide you along the journey, because, like I said, everybody's journey is different, and there are some things that you'll be able to achieve and some things that are just simply going to be off the table, dependent on how severe your symptoms are.
I found that listening to my body was the biggest lesson I've learned through my experience with PCOS. So I had terrible body acne forever. It was just what I thought was a part of me.
Yes.
And then I was put on birth control. Typical one is Diane 35. I mean, of course,
to help control the acne.
Help control, it worked wonders. But I mean, at 17, 18, I thought it was weird being on birth control so early. And I made a decision, actually, and I made a personal decision to come off, and I changed my diet, and I became pescatarian. So, and specifically, I'd really wanted to cut out chicken and meats and dairy. I knew that there were hormones added. You know, you can just, I could see.
All of those things are hormone friendly.
Yeah,
so.
my breasts were getting big out of the blue, all of those things. And so I came off, and you know that the acne was under control. Yeah. Just from, you know, using a little salicylic acid wash and eating right. And so how important is it that women actually take the step to listen to their bodies? Oh,
I mean, just hearing you tell that story, really, I was giving you applause in my brain, because a lot of the times that's exactly what happens. You have a young girl, she might have acne issues, and they put her on a birth control, even if she's not sexually active, because this birth control is supposed to help control her hormones, but they come with side effects. And then another thing that happens too is that you realize that the age for first period is getting younger and younger. I have girls as young as 8 who are starting their periods. And when you look at them as 8, they look like a 15-year-old, because their bodies are so developed. And that comes back to what we are eating. A lot of those foods that you talk about, they add excess estrogen to our systems. And their little systems are being, matured so early, even though their brains are still an 8-year-old brain. You understand? So it is so important to learn your body and to know what a healthy body looks like, so that you can tell the difference whenever something is wrong.
And ask questions.
Of course, you have to ask questions.
And that leads me to thinking and wanting to discuss the medical community and how they treat PCOS. I've had endocrinologists look at me and they go, you do have, they go like this, you do have
but they're expecting you to be fat.
Yeah, I do think that we still have a long way to go. What are your thoughts on the medical community in relation to PCOS?
Well, I work very closely with the medical community in Jamaica, and for the ones that I do work with, they are open-minded. Dr. Abrams, anyway, they big up yourself. I have to big up Dr. Abrams, because Dr. Abrams did not hold me back at all. When I told him what I wanted to do, he was like, just keep me posted, just tell me what's going on. And I said to him that I want to do this thing for an experiment for 3 months, just to see what it feels like. Now he's having nutrition conversations with his patients. And I really think that's the best way to look at it, because the fact of the matter is that everybody don't know everything. And I think that some of the doctors need to be open and listen to their patients and listen to their story and their symptoms and their journey, because that's going to help them to better treat them. But if you're coming to it like, well, I'm the doctor and I know everything and you can't tell me nothing about your own body, then we're going to have a problem, because, you're not going to be able to treat that patient, because you're not even giving the ear to understand what their journey is, so that you can tailor the treatment for them. Because like I said, everything has its place, but everything don't work for everybody the same way. So you have to be able to make that adjustment. I really do encourage doctors to be more open. I really encourage them to listen more. And I encourage women to be more proactive when it comes to their overall health.
And owning their body, because I think also invasive versus non-invasive approaches. So for example, you could have had surgery.
Yes.
And you chose a non-invasive approach. It may have delayed the process, but it saved yourself the trauma of surgery, losing your womb.
Yes.
Right?
Yes. Of course, and that's another thing, you know, I'm very concerned about how willy-nilly we are seeing some very serious procedures, because I'm talking to women in their early 30s who have already done a hysterectomy, and they're on synthetic hormones, and their whole system is off because, you know, they're gaining weight, they're having weird acne, because their hormones are not functioning how it's supposed to function. And like I said, I think all of it has its place, but I'm really, really troubled when I'm talking to somebody so young who still is being told to do a hysterectomy. So I think that a conversation needs to be had around
So there's
that.
a role there's a huge role we play in the process when you are diagnosed with PCOS.
Yes.
I would imagine then that if in the medical community we're still learning more about it and there's still a lot of adjustments being made, the general public now, do they even know what that is? I mean, you know, if I have a partner and I say I have this thing, PCOS, are they going to know about it and how to even help me or take care of me?
Well, that's why we're having this conversation right now, you know, because we have to make people aware of it. And by the way, where's my camera? Gentlemen, we're talking about female reproductive health. It does not mean that's a woman's problem, and doesn't mean that you can get to turn off the station and just ignore it. It is your problem too. If there's a woman in your life, especially if you're having sex with said woman, you need to know what is going on with her body and how you have a very important supportive role to play. So listen to her, help her, rub wherever she wants you to rub, and participate.
Absolutely, because and women, I think we were trained to hide and be ashamed of having a cycle. I remember when I first started and I didn't know who to talk to. You know, thankfully I had my mom there, but you might be on your period and you don't want people to know. No, I just put the tampon in my back pocket and I'm like, I have to go to the bathroom.
As it should be.
Because there's nothing to be ashamed of.
As it should be.
Yeah.
If you never know before, women between the ages, well, the age kind of different, but anyway, women of a certain age, we have periods.
And that's just
right now, wherever you are, there's a woman around you having a period.
Yes.
Okay?
And it's not
period
gross.
is everywhere.
It's not gross.
Period is life. Hey!
It's not bad.
Rock stoplight.
Yeah. So, all right, so as we wrap up, what is the silver lining? There has to be some hope. There has to be a light at the end of the tunnel.
Well, that is easy. More women are becoming doctors, and because more women are becoming doctors, things that affect us are becoming important. And so the research is being done, and it's being done by so many brilliant women, and I'm just excited to see what's going to happen over the next 5 years or so, but there is a lot of persons working on it, so there is hope.
And I think that one of the biggest positive sides to it is that it's not your fault.
Yes.
And I think once you understand that, you recognize that it is not you, and you can actually treat it as a separate thing.
And it's not a sentence.
And it's not a sentence. And you can, and it doesn't have to become a big part of your identity. It can just be something that you're managing as you go along. And it's empowering too, when you can overcome all of the challenges that come with it because you understand and you do the research. And you take authority.
Yes,
over
man.
this body.
One last thing before them run me, because I get you the signal. One last thing. Tell your story. The more of us who talk about our experiences is the more we help each other. There's a whole heap of strength in telling your story. You not only empower somebody else, you empower yourself. There's a lot of women who are suffering in silence right now with exactly what you have, and you telling your story is going to help them get the help that they need to get to tell a story.
Yeah. So listen to your bodies, tell your story. Thank you so much, Dr. Sexy-Ann.
Oh,
we could talk for hours about this. Oh my gosh. So this is PCOS 1 in 10. I'm Naomi Cowan. Thank you so much.